Today in our Ask the Doctor segment, we are talking about a very important topic, the difference between a stroke and an aneurysm. Dr. Jay Sharma, he is a board-certified interventionist neurologist affiliated with Brookwood Medical Center, and this is what he studies and helps people all the time. Good to see you, Dr. Sharma.
Thank you, Janice. Thank you for inviting me.
Thanks for coming by. We do have callers that are going to call at 741-9272, so hang on to that. But we want to talk quickly about the difference between a stroke and an aneurysm.
Oh, yes. So now stroke, usually people know a lot about heart attacks and chest pain, and they have that awareness that they have to come to the hospital right away. Same as a stroke. When there is blood flow that is stopped going to the brain, then those patients can get a stroke. That tells us that if there is a clot in the brain is not getting enough blood flow, and they can have symptoms of face, arm, and leg weakness. Now, brain aneurysm is little different entity. It's more of a abnormal blood vessel in the brain, and it's like a balloon-like outpouching.
But are there any symptoms to lead up to that, or does something just happen?
Oh, yeah. So now there are two. If the strokes, when we talk about strokes, there are two types of strokes. One is when there is no blood flow to the brain. That's what we call ischemic stroke. Then hemorrhage, that people know, brain bleeds.
Right.
Brain bleeds are hemorrhage in the brain. And usually these aneurysms, they can rupture and cause brain bleeds. Now, if someone is having a brain bleed, then they will come with this bad headache, worst headache of their life.
Oh, wow.
So those patients, I will say, they may have aneurysm in the brain and that leaked. Now, if someone is having a stroke, then they will not have that worse headache, but they will have this face, arm, and leg weakness.
Okay, and it's not always, we just recently discovered with a family friend that you don't always have the speech problem. You can be having a stroke and not have the speech problem.
You are absolutely right, Janice. Sometime if someone has high blood pressure, if they have a small stroke in the brain, that can evolve with some sensory symptoms such as numbness in arm and leg, and then a little bit later it can involve the face and have slurred speech.
Okay.
But yeah, you can miss
always
that. Not
slurred
always.
Speech.
Yes.
Okay, let's go to our first caller, and I think he has a question about perhaps numbness. Who's our first caller, Suzanne? Hello?
Yes, this is Charles Harrison.
Hi. Go ahead with your question.
Yes, I'm having numbness in my arms at night, going to sleep, sort of like, you know, and I just have to shake them. And are there any concerns on that, or?
Yeah, no. So if most what we worry about with numbness in arm, leg, and face, that it can be a stroke. But you said you just are having numbness in your arm?
Yeah, both arms.
Both arms.
Yeah.
Usually when you wake up in the morning or when you go to the sleep?
Well, this occurs at night.
So when you wake up in the morning, does it go away?
Yeah, after I get up and get to stirring, it goes,
Oh, yeah, it may be just the way you are sleeping. It can be your mattress or some other things, because if it just comes and goes, I don't think these are the signs of stroke. But also, I will say you should see a neurologist in clinic. We definitely want to rule out any neck problem. Sometimes if someone has a neck problem, that can also give this tingling numbness.
So it could be something else.
It can be something else, yes.
All right. Well, I want to have it checked, but it sounds like at least it's not a symptom of a stroke.
Yes.
Okay.
Yes.
All right. Let's go to Latoya. She is our next caller. Latoya, good morning.
Good morning. How are you?
Good. What's your question for the doctor?
Yes. Every day I've been having pain in my arm, and it starts from my neck on down to my fingertips, and the fingertips get numb. And when I sleep on one side at night, I have chest pains under the bottom of the left of the right side.
Yeah, Latoya, so couple of things for you. You are having neck pain that radiates to your arm. So as I said earlier, you may be having some neck issues. I will say you should see a neurologist or your primary care. You definitely need some imaging of your neck. In terms of chest pain and shortness of breath, we worry about the heart, and same thing, when you'll see the primary care, they will do some tests to make sure your heart is okay. So my money will be on neck and heart.
So when you are having a stroke, does it come on? And I think I'm getting from these questions from people, or do you start having the symptoms before you have the stroke?
Oh,
and
yes.
it sounds like you maybe not, you won't feel numbness
Yeah,
until
no,
you're
so
having it?
usually if someone is having symptoms again and again, those are the signs of maybe nerve issues. Now, with a stroke, it happens acute onset. That means it will
Okay.
happen right away.
There's really no warning then?
No warning signals. Usually, if someone is having a stroke, they may complain of this slurred speech, face and arm weakness that happen like right away.
Right.
And those patients, I recommend they should come to our ER right away. The magic words that we use is time is brain.
Right.
Every 1 minute you lose millions of brain cells if someone is having a stroke. Now we have these clot buster medications that we can use up to 3 hours.
But yeah, so you have to have within 3 hours of
Within
the
3
onset of the
yes.
symptoms. Okay, let's go to Betty. Betty is in Empire. Betty, do you have a question about strokes or aneurysms?
Yes, I have an aneurysm in my aorta, and I wanted to know how big it would have to get before they do anything about it.
That's a great question.
It's a very good question, Betty. Now, what I will recommend is aortic aneurysms. Sometime we just keep an eye on it, and if it grows up to certain size, then we recommend treatment. You will benefit from seeing a more of a cardiovascular surgeon that can follow you with ultrasounds. So my recommendation will be you should go and see a cardiovascular surgeon.
And she may be already under someone's care. It sounds like they
Yes.
obviously know
Oh,
that
yes,
it's in there.
absolutely.
But I guess, would it have to get to a certain size?
Yes, so usually the brain aneurysms, a very small size, we definitely want to treat, because if they leak, that can cause brain damage.
Okay.
Now, aortic aneurysms are more up to 5 to 6 centimeter size. We can watch it. We do ultrasounds as a follow-up. If they are growing, then also needs a treatment.
Okay.
So it all depends on other comorbidities and where we are.
All right. Some great questions, great answers. Dr. Jay Sharma, for the first time with us.
Oh,
Thank
thanks,
you
Janice.
so much.
Thanks for having me.
Appreciate you coming by.